Hi, my name is Victoria Dalton. I am USU FNP student. This is class 596, and I need your consent to record this video for my professor to grade me, record and post on YouTube.
Yes, you have my consent.
Okay, perfect. So before we start my assessment, I'm going to sanitize my hands, and I have my supplies here for the future assessment of my patient. And can you, I am Victoria Dalton, I am FNP. I am here to assess you today.
Okay.
Okay, so can I have your name and date of birth?
My name is Marina Dushchak, and my date of birth is 12/02/1998.
And how old are you?
26.
What's your ethnicity, Marina, and nationality?
Ethnicity, I would say I'm Caucasian, and nationality is I'm Ukrainian.
Perfect. And what brought you in today?
I have a few issues that bother me for the past 10 days. I have been having some headache occasionally, on and off, and then I have some like pressure and like pain over here, like in my forehead area, and then like I have a really stuffed nose that it's always stuffed, it doesn't go away, and then I've been having some like just like I don't know, like I guess like clogged ears or something. And also I started having a fever 5 days ago, and it hasn't stopped since.
Okay, and what fever?
101.
Okay, and when the symptoms started?
10 days ago.
Then okay, and where is the pain located mostly?
So the thing that bothers me is my nose, and it's like right here. And then as far as the pain goes, it's just like when the headache starts, it's just all around here.
And what kind of pain is that? Like stabbing, like sharping?
It's just like throbbing pain.
Throbbing pain?
Yeah.
Okay, and then what makes it, what helps you with the pain?
I take Tylenol.
Okay.
I would say like at least twice a day.
And it helps you?
Yes. And then I also like to take a warm or like a hot shower and just like massage these areas. And that helps me too. And then I would like I'm able to get some stuff out.
Okay.
And it would be like just a nasty green color, and it just doesn't look too normal to me.
Okay, what makes the pain the worst?
What makes it worse is when I drive in the car with the AC on, and just like anything that blows just like really makes it worse.
Okay, so do you have any other symptoms or signs?
No, not really.
Not really? Okay, and you mentioned you had a fever for how long?
5 days.
5 days. Okay, and that's 101?
Yes.
Okay. So, and we're gonna move to your past medical history right now, okay, Marina? Tell me about your health.
I'm in pretty good health, I'd say. Okay. The only thing is that I'm aware of is that I was diagnosed with hyperthyroidism about a year ago. 3 years ago.
Okay, and when was last time your blood work run, and when you see the doctor last time?
A year ago.
A year ago?
Yeah.
Okay, it's basically time to recheck your...
Yeah.
Okay, so do you want me to run today your blood work?
No, that's fine.
Okay, so you said, do you take any medication for hyperthyroidism?
Yes, I take levothyroxine.
You know the dose?
I believe it's 75 micrograms. I'm not too sure.
Okay, and once a day?
Yes.
Okay, thank you for sharing. Did you have any hospitalization, trauma, any surgery in the past?
No.
No. Okay, so when was your last menstrual period?
Like 2 weeks ago.
2 weeks ago? Okay, so are you pregnant right now?
No.
Okay, did you have a pregnancies in the past?
Yes, 2 pregnancies.
Okay, so when you seen the OBGYN doctor last time?
It was around a year and a half ago.
Okay, what was findings in there?
Nothing, it was just a postpartum appointment.
Postpartum appointment. Okay, do you have a kids?
Yes, I have a kids too.
2 kids? How old are they?
3 and 1.5.
Hard to believe.
Yes.
You look so young. Okay, thanks for sharing. Okay, Marina, so do you have any allergies?
Yes, I would say seasonal allergies.
Yeah. What do you know what exactly allergies you have?
I don't know what I was allergic to, but I just know that when everything blooms, I have the runny nose and like I sneeze all the time, and I have like really itchy eyes.
Do you have itchy eyes today?
No.
And okay, perfect. So what is your immunization up to date?
I have all of my childhood immunizations, and that's it.
Okay, so what about COVID shot and
I don't have COVID, no shot.
No No COVID shot?
No.
What about flu shot?
No flu shot.
No flu shot? Do you want
No.
to do it today?
Absolutely not.
Great. Perfect. So let's move to your actually I have to ask you about your dental and
Yeah.
your vision exam. So when was that last time? Do you remember?
Vision exam was probably a year ago, and dental was a month ago.
Okay, and any findings, any problems with
No.
your dental?
Mm-mm.
Okay, just regular checkup.
Yeah.
Okay, perfect. So we're moving to your family history and
Mhm.
tell me about your parents.
Both parents are alive, both in good health, with no chronic disease or anything.
Okay, what
Yeah.
about your grandparents on paternal side?
Paternal side, my grandmother is alive. My grandfather is deceased.
Do you know the reason of the
Lyme disease.
Lyme disease? Okay, and how old your grandpa?
I don't know, like 65 or something.
Okay, so what about maternal side?
Both deceased.
Okay, so
Yeah.
do you know the age and the reason of the death?
I think that my grandma was 76 and she had diabetes and hypertension, and then my grandpa passed from COVID at
Okay,
86.
sorry to hear that, Marina.
Yeah.
Thanks for sharing.
Mm-hmm.
Okay, now we're moving to your social history. Okay, where you were born, Marina? Tell me.
In Ukraine,
In Ukraine?
Yeah.
And what year?
1998.
Okay, and you are Ukrainian
Yes.
and you're
American now.
American now.
Yeah.
Okay, I'm glad to hear that. Perfect. So are you married, Marina?
Yes, I am.
Okay, so your partner is a male or female?
Male.
Okay, so do you have kids you mentioned
Yes,
before?
two kids.
Two
3
kids.
and 1.5.
Okay,
Mm-hmm.
so you had two pregnancies and
Yes.
two like kids. Okay, perfect. And tell me about where do you live? What is your economic status?
We live in a house.
Okay, so 2-story house.
Yeah. 2-story house.
Okay. So do you feel safe in the house?
Yes, I feel safe.
Okay, do you have a gun in your house?
No.
Okay, awesome. So tell me about what do you like to do in your free time?
I like to go for walks.
For walks?
Yeah.
Okay. So you exercise, that's your exercise? Or you do
No,
exercise also?
I also try to work out like 2 to 3 times a week.
Oh, wow,
Yeah.
so cool. Awesome.
Mm-hmm.
Okay, tell me what would you prefer to drink? Alcohol, what kind of alcohol drinks?
I like to drink, I would say wine.
Wine? Okay,
Yeah.
how often?
Maybe like once a week.
Once a week?
It's just something to take
what
the
kind
edge
of
off.
wine?
Red wine.
Okay, awesome. Thank you for sharing. A glass of wine or a bottle of wine?
Glass of wine should do it.
Okay.
Yeah.
Thank you. And do you smoke, Marina?
No.
No vape?
No vape.
Do you use tobacco products?
No.
No? Okay, very good. So tell me, Marina, about your sleep pattern. How do you sleep?
Good.
How many hours you sleep?
On average, like 7 hours a day.
Okay, you waking up during this?
Yeah, I still wake up.
What's the reason for waking up?
My kids.
Okay,
Mhm.
awesome. How many times you waking up?
At least twice.
Do you feel rested after you wake up?
Sometimes, yeah.
Okay.
For the most
So
part.
tell me about your diet. What do you prefer to eat?
I would say I try to eat pretty healthy. I try not to eat out as much. I like to, I don't know, just have some kind of sort of protein and like a little bit of like carbs or something. Vegetables, just depends on the day, honestly. Whatever I'm in the mood for.
Okay. Do you drink Coke?
What?
Coke? Like soda?
Occasionally, yes.
Occasionally. Okay, how often?
I don't know. Maybe like
Why are you laughing?
nothing. 3 or 4 times a month.
A month? Okay.
Yeah.
Awesome.
Whenever I'm in the
Do you
mood.
drink enough water?
Yes, I try to stay hydrated.
Okay. Yeah, I'm gonna encourage you to drink more water.
Thank you.
Okay, perfect. Okay, Marina, do you use any recreational drugs like marijuana or cocaine?
No.
No? Okay, good to know. Thank you for sharing.
Mm.
Okay, Marina, thank you for that. And then we're gonna move to your review of systems. Okay, I'm gonna ask you questions. You just certain questions regarding your body system. You're gonna answer me.
Okay.
Okay, so do you have an unintentional weight loss, chills, or fever for last 6 months? I would say
No.
no. Okay, very good. Do you have any vision changes like double vision, blurred vision?
No.
No. Do you have a problem with the swallowing, chewing food?
No.
No problems with that. Okay. Do you have like GI problems like stomachache, like nausea, vomiting, diarrhea, blood in the stool? Did you
No.
notice any of that?
Mm-mm.
Okay, very good. Do you have any cough, shortness of breath?
No.
No.
Mm-mm.
Okay. What about do you feel like palpitation? Do you feel like irregular heartbeats?
No.
Shortness of breath?
No.
No. Awesome. Do you feel like painful urination, blood in your urine?
No.
Can you see it sometimes?
No. Mm-mm.
Nothing of that. Awesome. Do you have changes in your skin, like lesion or
No.
some rashes? Nothing of that. Okay. Do you have your wounds healing longer than usually or easily bruising?
No.
Okay. Do you have a joint pain, joint stiffness or pain or muscle pain?
No.
Unsteady gait?
No.
No. Do you have a dizziness, headaches?
No. Just right now I have
Just
like
right
headaches.
now.
Yeah.
Okay, perfect. What about your? Do you have like anxiety? Do you have depression? Do you feel
I wouldn't say that I have anxiety, but sometimes I do feel anxious.
anxious?
Yeah.
Okay, and when it started?
I feel like after I had kids.
Okay.
Yeah.
What is your anxiety about?
I don't know, just like being worried about just I don't know.
When kids getting
Yeah.
sick or anything
Yeah,
else?
things like that.
Okay, awesome. Okay, tell me more about your allergies.
Mm-hmm.
Do you have any allergies?
Yes.
Yeah. Okay, you said
Seasonal
seasonal
allergies.
allergies. Yeah. Okay, perfect. So I guess we went through everything: skin,
Mm-hmm.
and then allergies
Mm-hmm.
and immunology. Okay, perfect. So now we're gonna move to physical exam.
Mm-hmm.
Okay. So on the basis of the data that I collected from the patient, I'm gonna be performing ENT exam. I'm gonna check with my tools. So first, I'm gonna assess her head. Can you move
Yes, of
closer?
course.
So, do you have any pain?
I would say it's really tender over here.
Okay. So the head is normocephalic. I see patient. Okay. So I'm gonna palpate frontal sinuses. Do you have pain here?
Yes.
Okay. And then I'm gonna tap. Okay.
Oh,
Okay.
very nice.
Okay. And then maxillary sinuses.
Mm-hmm.
Do you have any pain?
Yes.
Both sides?
Yes.
Okay, so now I'm gonna check nasal passages. Okay, and I see redness here, sign of inflammation, and I see a purulent discharge. Okay, can you close one nostril and take a breath? Yeah, and another side. Yeah, okay. And say ah, and your tongue out. Yeah, and I see postnasal drip. Okay, so I'm gonna palpate her lymph nodes, occipital, post-auricular, pre-auricular. Painful here?
A little bit, yes.
A little bit. Submandibular. I see inflamed submandibular on the left side, and submental, cervical. Okay, so now I'm gonna check her eyes, her pupils, and we want to see them reactive to the light and equal. Left eye, right eye. Yeah, so they was equal and reactive to the light. So next I'm gonna listen her lung Oldfields, anterior and posterior. We take a deep breath in and out. And lateral and posterior. Lung sounds are clear. I don't hear any wheezing or ronky. So now I'm gonna listen her heart. I'm gonna listen aortic valves, pulmonic, tricuspid, and mitral. Also, it's point of maximal impulse. So I hear S1 and S2 present, and patient is tachycardic. So on a basis of data that I collected from the patient, so I want to go over the diagnosis that I have in mind. So the main diagnosis would be acute bacterial sinusitis due to her temp fever and the pain in maxillar and frontal sinuses area. For the differential, it would be cluster headache. But I can rule out it because of the cluster headache never present with the fever. And then another, the differential would be allergic rhinitis, since she mentioned she has in a past medical history allergy, seasonal allergy, but since her eyes is not itching and there is no discharge, and I see her purulent discharge from the nose, I can say the main diagnosis would be acute bacterial sinusitis, and for the treatment, we're gonna prescribe her augmentin 875 milligrams twice a day for 7 days. Also, for the headache and for the pain, she can take ibuprofen or Tylenol, what she prefers. And then also she mentioned she has the ear fullness, like stuffiness. We can check that also. We're gonna check her. I don't see sign of infection here. I can't see any redness. It looks good to me. So we can prescribe her. I prescribe her Flonase, which gonna help with the inflammation and release that pressure in her nasal cavities. For the non-pharmacological treatment, I recommend her normal saline irrigation of the nose. And then for the referral, I don't think she would need referral right now, but if the patient, I'm gonna educate my patient if the symptoms are worsened during the treatment time, so she needs to address to ER. If the treatment will be with the positive effect, 3 times a year repeating the same symptoms, I would refer her to ENT specialist. So for now, I'm gonna order her imaging and CBC, so to confirm the diagnosis. But meanwhile, she's gonna go off for all that blood work and the imaging. She's gonna take antibiotics.
Okay.
Thank you. And I also educate my patient of importance to take antibiotics. Don't stop. We don't want to cause any resistance to antibacterial therapy. Okay, basically that would be it. And thank you, Marina, for coming.
Thank you for helping me today.
Yes, thank you.
Thank you.